Let's learn the embryology and radiological anatomy of the pituitary gland. Coming to the embryology, an outpouching is formed from above from the diencephalon or the primitive hypothalamus. Another outpouching is formed from below from the ectoderm of primitive oral cavity. The invagination of ectoderm of primitive oral cavity is also called as Rathke's cleft. The part from the diencephalon forms the posterior pituitary or the neurohypophysis, and a part derived from the oral cavity or Rathke's cleft forms the anterior pituitary or the adenohypophysis. Moving on to the anatomy, the part labeled M is the mammillary body and this is the tuber cinereum. This part is called as the median eminence and the stalk of the pituitary is called as infundibulum. Anterior part of the pituitary is called as adenohypophysis and the posterior part of the pituitary is neurohypophysis. There is an intermediate tissue between anterior and posterior hypophysis, also called as pars intermedia. Adenohypophysis produces luteinizing hormone, follicle stimulating hormone, thyroid stimulating hormone, prolactin, growth hormone, and adrenocorticotrophic hormone, whereas neurohypophysis acts as a storage house for antidiuretic hormone and oxytocin. Moving on to radiological anatomy, the bony anatomy of Sella is well defined on sagittal CT images. The fossa in which the pituitary lies is called as Sella turcica or pituitary fossa of sphenoid bone. Anterior part of the Sella turcica is called tuberculum sellae and the posterior bony wall is known as dorsum sellae. Meninges covering the pituitary fossa is called as diaphragma sellae. On sagittal T1 weighted MRI images, we can see the infundibulum or the stalk of the pituitary gland and the anterior pituitary gland, which appears iso-intense on T1 weighted images. The posterior pituitary gland shows classic bright spot on T1 weighted sagittal images. On coronal images, we can measure the height of the pituitary gland, which is given by Elster's rule. 6 mm height is for infants, 8 mm for men and postmenopausal women, 10 mm for childbearing age women, and 12 mm in pregnancy or postpartum. Thank you, and for everyday learning, follow our YouTube channel and Instagram page at Radiology Doodles.